Florence Nightingale, the Lady with the Lamp. Part A world without modern nursing. In the early 1800s, hospitals were very different from what we know today. They were often dirty and crowded. The smell of sickness and waste filled the air. Windows were closed to keep out the cold, but they trapped bad smells inside. Patients lay in beds close together, sometimes sharing the same blanket. Doctors focused on surgery or medicine. Nursing, the care of patients day and night, was not respected. Most nurses were untrained. Some were poor women who took the job only for food and shelter. Others drank alcohol while working. If you became sick or injured, going to a hospital was dangerous. Many people preferred to stay at home, even if they were very ill. This was the world Florence Nightingale was born into. And this was the world she would change forever. Part 2: Early life of Florence Nightingale. Florence Nightingale was born on May 12, 1820, in Florence, Italy, the city after which she was named. Her parents, William and Frances Nightingale, were wealthy English people traveling through Europe. A year later, they returned to England and settled in a large country home. Florence grew up in comfort. She had servants, fine clothes, and the best education. Her father taught her mathematics, languages, and history, unusual subjects for girls at that time. She learned French, German, Italian, and even some Greek and Latin. But Florence was not interested in parties or fine living. She was serious, quiet, and thoughtful. From a young age, she felt called to help others. At the age of 12, she wrote in her diary that God had spoken to her and given her a mission, to serve the sick and poor. Her parents, however, had other plans. They wanted her to marry a rich man and live the life of a proper Victorian lady. Florence refused. She believed her life had a higher purpose. Part 10: The decision to become a nurse. In the 1830s and 1840s, nursing was not considered a job for a respectable woman. Hospitals were dangerous places, and the work was hard. A lady of Florence's class was expected to stay far away from such things. But Florence had seen suffering around her. She visited poor villages near her home and gave food and medicine to sick people. She wanted to learn how to care for the sick properly. In 1844, she told her family she wanted to train as a nurse. They were shocked and angry. For years, they refused to allow it. But Florence was patient. She studied nursing books in secret. She visited hospitals to see how they were run. She practiced basic care with sick neighbors. Finally, in 1849, after many arguments, her parents agreed to let her travel to learn more. She visited hospitals in London, Paris, and Germany. In Kaiserswerth, Germany, she trained with Protestant sisters who ran a hospital with strict discipline and cleanliness. She learned how to prepare food for the sick, how to keep wards clean, and how to organize patient care. Part Chart: Building skills and a reputation. When Florence returned to England, she was different. She now had real nursing skills. She believed that hospitals could be clean, organized, and safe. She also believed that proper training could make nurses respected professionals. In 1855, she became superintendent of a women's hospital in London. She improved ventilation, cleaned the wards, and made sure patients had nutritious meals. She kept careful records of illness and recovery. Her work gained attention, but soon, an even bigger challenge would come, one that would make her famous across the world. Part 5: The Crimean War begins. In 1855, war broke out between Russia and an alliance of Britain, France, and the Ottoman Empire. This became known as the Crimean War. Fought on the Crimean Peninsula near the Black Sea. Reports from British military hospitals were shocking. Injured soldiers lay in filthy conditions. There were not enough beds, clothes, or medical supplies. Diseases like cholera and typhus spread quickly. In some hospitals, death rates were higher than on the battlefield. The public was outraged. Newspapers printed letters from soldiers describing the terrible conditions. The British government realized it needed help. In October 1854, the Minister of War asked Florence Nightingale to lead a team of nurses to the military hospital in Scutari, Turkey. Florence agreed immediately. She selected Attrish nurses, a mix of trained women from religious orders and untrained helpers, and set sail for the war zone. Part 6 Arrival at Scutari. Florence and her team arrived at the barrack hospital in Scutari in November 1854. What they saw was worse than they imagined. The building was overcrowded and dirty. Sewage leaked through the floors. Rats ran between the beds. There was no proper laundry, so uniforms and sheets were filthy. Many soldiers had no blankets at all. At first, army doctors did not welcome Florence. They did not believe women should be in military hospitals. They refused her help. But soon the number of wounded soldiers increased so much that the doctors had no choice. Florence and her nurses began cleaning the wards, washing clothes, and preparing better food. Part 7 The Lady with the Lamp. Florence did not just organize the hospital. She cared for the soldiers personally. At night, after the doctors had gone, she walked through the dark, silent wards with a small lamp in her hand. She checked each patient, spoke softly to them, and made sure they were comfortable. Soldiers began calling her, the lady with the lamp. Her presence comforted them. They wrote letters home saying that she was like an angel watching over them. Part 8 Fighting Disease. Florence quickly realized that more soldiers were dying from disease than from battle wounds. She studied the hospital's records and found that poor sanitation was the main cause. She worked to improve drainage, clean water supply, and food preparation. She insisted on fresh air and regular hand washing. The results were dramatic. The death rate in the hospital dropped from 42% to 2%. This was one of the greatest medical improvements in wartime history. Part 9 Return to England. Florence returned to England in 1856 as a national hero. Crowds cheered for her. The Queen invited her to Windsor Castle to thank her personally. But Florence avoided public celebrations. She went straight to work studying military health problems. She used statistics to show how poor sanitation killed thousands of soldiers. Her famous diagrams, called coxcomb charts, made the information easy to understand, even for politicians. Part 10 Lasting Legacy. In 1860, Florence opened the Nightingale Training School for Nurses at St. Thomas' Hospital in London. Her graduates worked all over Britain and the British Empire, spreading her methods. She wrote books on nursing and hospital design, influencing public health worldwide. Florence spent the rest of her life promoting better sanitation in hospitals, army camps, and poor neighborhoods. She believed that clean water, fresh air, proper drainage, and good nutrition were as important as medicine. Part 11 Later Years and Death. Florence's health suffered after the Crimean War, and she spent much of her later life in bed. Still, she continued her work through letters and books. In 1907, she became the first woman to receive the Order of Merit, one of Britain's highest honors. Florence Nightingale died peacefully in her sleep on August 13, 1910, at the age of 90. She was buried, quietly, according to her wishes, in her family's village. Part 12 Legacy for the Modern World. Today, Florence Nightingale is remembered as the founder of modern nursing. Her insistence on cleanliness, proper training, and compassionate care changed hospitals forever. Her work saved countless lives and inspired generations of nurses around the world. The image of the Lady with the Lamp remains a symbol of dedication, courage, and service to others.